Thank you so much and welcome everyone. First, I'd like to thank London Business School and the outstanding China Club team for making this event possible in very, very difficult circumstances. And any of you that were there as I was yesterday will want to congratulate them on an amazing day. Team, you did a fantastic job. So I'm Alan Barrell. I'm honored to be chairman and moderator today. And my profile and those of all our panelists are online. And because we have limited time today, we're not going to do very detailed introductions. We're going to go immediately to our topic, reflections on COVID-19. That's our context and background as we look together at the role of innovation and technology adaptation and adoption in disease control, with the future very much in mind. We are emerging, hopefully, from the worst global pandemic anyone alive at least can recall. I can't find any true comparison in recent history. So how can we learn from the horror and the tragedy of the past 4 months, and what might be done to protect the world and its people from such an event happening again by effective or more effective disease control? The economic consequences of the pandemic we know will be shocking and profound, and we discussed them yesterday. But the focus of our panel is not the economy, but disease control, and the key aspects of how innovation and the adaptation adoption of technology might be optimized in order that we can bring wisdom and will and transparency to balanced international collaboration and share knowledge and expertise and experience in telemedicine and in other innovative technologies in ways that perhaps have never been seen before. Can we bring greater cohesion between all the necessary elements in healthcare systems, and they are very different in different countries, we know that, and can we use our growing capabilities, for example, in artificial intelligence and in machine learning to make really big differences to the way things are in the future? And we're going to discuss also what might be possible success models for the serious investments which will inevitably be needed in global healthcare and public health provision. So each member of our distinguished panel that you have heard about will begin by addressing a specific question and aspect of these very huge issues, and others will contribute, and you can all pose questions. We invite you all to think about and maybe record some of your thoughts and ideas, because we do plan to use the time we have not only for discussion, but perhaps to generate a record of the event and maybe making special note of a small number of key areas we can produce some kind of report to share and possibly to publish. And we'll let you know about how you can contribute to that if you want to as we conclude. So my fellow panelists, to remind you, Xing Sun of AXA Next Labs, Dr. Stanley Li, founder of DXL, Dingjiang Doctor, and Dr. Nicholas Ibery, General Partner and Global Head of Health at NCL Technology Ventures, a London-based VC fund. Please welcome them. So first to Xing, where I know at AXA, because you've told me, Xing, you're looking at challenges of integration and coherence involving patients, health providers, funders, with objectives to improve outcomes, including through telemedicine. So please get us started and tell us a bit more about these initiatives. Welcome, Xing.
Thank you for your introduction, Alan, and good morning and good afternoon, everyone. It's my pleasure to connect with you in a special way today and share my observation on Insurers' role in promoting better health outcome. As Alan rightly pointed out, during the COVID-19, AXA has provided telehealth services to approximately 6.5 million people in Asia. In China, AXA partnered with an online medical services provider, Tencent Trusted Doctors, to provide access to 450,000 professional medical doctors and psychologists online for AXA customers and employees. The similar teleconsultation services are also offered in Indonesia in partnership with a local player HelloDoc, in Philippines with My Pocket Doctors, and in Thailand with BDMS Network Hospitals and Prairan 9 Hospitals. But AXA's telemedicine focus is not just a tactical response to the COVID-19, rather a reflection of a global movement of insurance industry, from simply issuing a check to customers to providing the value-added services to the customers. And this player-to-partnership is born from the fact that in a healthcare ecosystem encompassing patients, providers, government, and private insurers, the interests of various parties are often not aligned, resulting in the patients could not access to the treatment they need, or health providers for overprescriptions, and the funders could not control the health cost. So the integration with services enable the insurer to help patients to go back to the health status more quickly, and in a way to achieve cost containment in times of aging population and rising healthcare cost. Telemedicine is just one of the health services integrated by AXA. During the peak of COVID times, we have seen a surge of usage of telemedicine at various platforms in China. Although such hype may taper off, the telemedicine industry, in my view, will not go back to where we were before the COVID-19. I think the pandemic acted as a catalyst for the telehealth development in China in terms of shaping users' confidence and gaining government support. A case in point is that in March, the government just announced a pilot program in 10 cities to extend the national health coverage of teleconsultation, e-prescription, and drug deliveries for 10 chronic diseases, such as diabetes, Parkinson's, and hypertension, which often involve regular doctor visits. So now patients with those diseases can get online consultation and get referred to retail pharmacies. And after payments, they can entrust the local community to deliver medicines. But having said that, despite the technology advance in China, the medical resources are still scarce on the per person basis and are also disproportionately concentrated at the 3A hospitals and the first-tier cities. To help spread the medical resources, China is building community clinics with GPs and encouraging doctors to practice out of the public hospitals one day every week. And if we take a bold prediction, we will see the medical resources will be shifted from the hospital to community and to home, which we described as home as a new hospital. With the integration of artificial intelligence, wearable devices, we will allow people to stay at home, but still be treated for chronic conditions, critical conditions, or for elderly care. And again, COVID-19 crisis is showing us that whatever can be accessed at home is really the future trend that people may want to see. We still need to go visit the practitioners or receive specific treatments at the healthcare centers. But as much as we can move all of that from the hospital back to home, then this will be the last mile to our China healthcare transformation. And I see we have a role to play there as a private insurer.
Thank you, Xing. That's extremely interesting. And I know that it touches on a lot of the issues that Stanley has been working on with this very, very innovative company that he founded, especially related to consultation, the use of information at home. And Stanley, so much has been said and written about the importance and value of teleconsultation, for instance, in medicine to improve the quality of healthcare information and to deal with misinformation, which is dangerous. So Stanley, please throw some light for us on what has been noted as most successful, certainly in your experience and maybe internationally, and are we making progress in connecting more effectively between people, doctors, and best practices, and what more can be done? And what is the philosophy behind these actions? So Stanley, over to you.
Thank you, Alan. Thank you for your introduction. Hi, everyone. Good morning. This is Stanley. I'm the founder of DXY. I built up DXY 20 years ago when I was doing my college. So DXY has become the largest physician community in China. We have covered over 70% Chinese doctors in total. In terms of telemedicine or excuse me, teleconsultation, I think from my perspective, consultation is just a part of telemedicine. Actually, telemedicine is much more than just an online consultation. So DXY position ourselves as online healthcare service provider. We are not an entertainment company. So we do want to deliver our products and services in a more entertaining way. But we are a professional company. So medicine and healthcare, actually, they are two different things. We position ourselves more on the health, on the wellness. We focus on the lifestyle instead of medicine itself, because medicine or hospitals, they are under heavy regulation. They have much more risks, and also being sick is kind of a low frequent activity. But if we look at health, we look at wellness, we look at our lifestyle, that is more high frequent, and also low risk and low regulations. And I quite agree with Xing's comments that I believe technology in the telemedicine is the best used for outside the hospital, not in the hospital. The hospital, I have been working there for years. It would be very difficult to change the traditional way inside the hospital. But outside the hospital, like at home or in your office, on the trip, there could some issues or conditions about health. So first, the DXY position ourselves on the health instead of medicine. We think medicine is too difficult to change. And secondly, when we look at COVID-19 outbreak, I can still remember that was our last working day before Chinese New Year. And we, every employee were already going back to home or going on vacation. Then we realized something bad would happen, and we organized an emergency group with over tens of people. So we decided to do something to deliver correct information. So first we launched our disease tracker. That is the first disease tracker in the world. And later on, Johns Hopkins also coded our data, use our data to build their website. And today you can still see DXY is on the source of Johns Hopkins dashboard. So first we do the disease tracker, and then we generate contents. The purpose of generating contents is to deliver correct information, science-based knowledge to the public. And also on the other side, we understand disease never spread in isolation. It could come up with rumors, conspiracies, misinformation, disinformation, sort of things. So we generated contents also to debunk the rumors, to change the people's mind. So the second thing we do is to generate contents. So in the past 3 months, we have generated over 3,600 articles, video clips, tweets to deliver the knowledge and information. So the disease tracker has acquired over 3 billion visitings, and our articles, video clips has also acquired over 4 billion visitings. So these two things combined together, we have acquired over 7 billion visitings. That is a huge number. That is probably the first time DXY has ever had in our past 20 years. And the second thing we were doing is online consultation. The reason why we put online consultation behind the knowledge bank and disease tracker is because we want people to read something first, to understand something first, to answer their most common concerns, to answer their most frequently asked questions through articles, through video clips. Then if they still have personalized or customized or complex question, they can go to the second part. They can go to online consultation. So that is our philosophy. And on the online consultation part, we have acquired over 1 million online consultation in the past 3 months. So if you look at 7 billion and 1 million consultation, there is a huge gap in between. And this makes sense because we build up online triage system. Knowledge bank and the disease tracker play the role as general practitioner. And online consultation actually play the role as a specialist. So the people will go to the GP to have the most common questions, to have their concerns released or solved. Then they can go to the online consultation part. So from our perspective, this model can save the doctor's time and also save the doctor from burnout and fatigue. If there is no knowledge bank or disease tracker on the front, if the huge traffic flooded into the consultation part, I don't think DXY can solve that problem. Even we ask all the doctors in China to go online to answer questions one by one, we cannot solve that problem. Just because we have some services and knowledge bank on the front, and then we collect over 15,000 doctors, and these doctors work very hard, and they can answer the question on the second part. So I think it's a very good model. So far, it has been proved, and the result is very convincing. So we saved both doctors' time, and also we saved the patient or the public's cost. So that is what we have observed in the past 3 months.
Thank you so much, Stanley. That's a phenomenal story. It's very inspiring to me, having spent virtually all my life one way or another in the healthcare system, mostly in the UK, our National Health Service and our industry here. And I just made 2 or 3 quick notes that I think we ought to concentrate a little bit more on. First of all, you make a very important distinction, Stanley, between health and wellness, or healthcare systems and wellness. And I'll ask Nick to give us some thoughts on this in just a moment. But certainly our healthcare system, which is based very largely in part on general practice, very different than the Chinese system, of course, where you are much more hospital focused. We don't, I think some of us have this distinction as clearly in mind as you do. And our health service, which is brilliant at saving lives, is in some ways perhaps a national sickness service rather than a national health service. That's not a criticism, it's an observation. And the other thing you mentioned is this interesting word triage, which frightens a lot of people because it seems to indicate to them that they may not be chosen to get treated if there is a shortage of care. Well, your definition, the definition, of course, comes from the French word to select. But what you said is very interesting to me because you are enabling the doctors to use their expertise much more in a focused way by doing some triage that sorts out a lot of the questions and dilemmas of people in the general public who may not really need a doctor at all, or if they do, can do it online. So Nick, you might like to cast a few thoughts on some of those things from your point of view.
Of course, Alan. First of all, good morning and good afternoon. Thank you so much for inviting me to participate, what's proving to be quite a unique event in the midst of this crisis. It's a pleasure to be here and to provide some humble contribution to the discussion. So I'm a London-based investor specializing in health and life sciences, mostly in the context of technology. And prior to this, I started my career as a doctor and a surgeon specializing in neurosurgery. And perspectives I'd like to think I bring is very much sort of leveraging the clinical background as well as some understanding of technology, and of course the system, the complex system that healthcare is, and increasingly integrated, not just regionally and locally, but of course globally nowadays. And I agree with comments made earlier, and just to build on Alan's and Stanley's comments about healthcare and well-being, personally, I subscribe to the view that healthcare, obviously we've been very preoccupied by solving problems and labeling patients with diagnosis and trying to mitigate problems when they occur, and somewhat less focus on keeping people well and healthy, both physically and mentally. And I have to say, I've seen a real shift in my certain humble career lifetime over the last couple of decades, away from purely solving problems and I suppose waiting for problems to occur and labeling patients and then trying to resolve those issues, to preempt them. Are we doing enough? Almost certainly not. We do have an opportunity through technology, through perhaps even what's happening now, to refocus. This may be a step change. I'm sure we'll expand on this shortly, to emphasize how important it is to really reframe our thinking about healthcare in general and try to address problems that ultimately what everyone cares about, all of us care about, which is to stay well, not just physically, but mentally as well. And of course, that could be a real issue even going through this crisis stage. And just to add, I personally, when I look at healthcare entities and potential investments, or in other contexts, and I do wear several other hats as well, I always look at healthcare in the broadest of senses, in terms of not just diseases or disease labels or diagnostic segments within the health and life sciences spectrum, but also adjacent areas, and really looking at wellness in a very different way to what some, say, investors or participants in the sector would actually describe.
Thank you, Nick. Can I ask you whether you feel that some of the well-proven in China things that Stanley has told us about could be adopted or adjusted for cultural purposes and be helpful to us in the UK or other European nations? Yes,
I mean, as I've mentioned earlier, I think I'm personally, I not just believe, but I've seen this really sort of play out in real terms, how integrated healthcare has become and how global it is. We used to say that healthcare services in particular doesn't really travel across borders that well. In other words, you can't just take one model, a successful model as it may be, and just transplant it into a different jurisdiction and expect it to essentially perform as well as it did in the original jurisdiction. So that's certainly true in certain settings and for certain things like pure services, and we still have lots to learn about that. But healthcare is becoming extremely integrated, and this is really facilitated by technology. We've talked about telehealth, so of course telemedicine is a lot more to it than just pure teleconsultations, and of course information exchange and what we can do remotely in terms of expertise exchanging, anything from research to best clinical input and advice. Those things are actively happening. So can we learn from China? Absolutely. Can we learn from each other in the broadest of senses across different jurisdictions? Well, personally, I am a big believer in that. And aspect forums like this are great ways of elaborating on that and finding specific ways. I mean, we are in a very unique situation at the moment, and we've obviously it's difficult not to talk about the crisis and obviously the pressures and challenges that inevitably will pose to the healthcare systems around the globe. I have to say, personally, I'm very focused on the paradigm that will follow this, not just the crisis period. And in my mind, and this is not a public health or indeed a strict definition of thesis, but I think about it in 4 stages. The stage 1, which is sort of us leading into the crisis or phase before the crisis. The phase 2, which is where we are now in terms of midst of this pandemic and trying to solve the problems that we're faced with. Phase 3, that is the coming out of the crisis, when we do have a clear exit strategy, and some countries are ahead in this. Again, we can expand on this, I suppose, as part of the later discussion. And of course, the phase 4, which is the new paradigm that will follow once we are out of this crisis, because we will come out of this crisis. And it's not the first healthcare crisis we've had on a global scale, although with unique challenges that this particular one poses.
Thank you, Nick.
I'm very focused on the
We will come back towards the end and pose the question, I think, of when it comes to global collaboration, what might governments do? I don't want to get involved with us in a great detailed discussion about government at this stage. But I think at the end of the day, there are things that certainly will need to have government support in order to bring about true global communication. I mean, Mr. Xi Jinping at the Coronavirus International Online Conference suggested that perhaps the health ministers of all significant nations should meet in some way or another fairly soon and discuss the future way of handling things like COVID-19. That's something we can talk about at the end. But I wanted to come back, and having heard what Nick says, thank you for that, Nick, to go back to Xing and Stanley and ask, first of all, Xing, how are things, your innovative ideas, are they progressing well? Are you gaining acceptance from the different agencies that you're approaching? Because this is quite a new way of looking at interrelationships and the role of insurers. Are you gaining ground in people believing that this might be the way forward?
Yeah, thanks, Alan. We are talking about the integrations of different stakeholders in this ecosystem, healthcare ecosystems. And this is something that doesn't come down to whether we are believing it will work. I think it's the future that everyone thinks it will moving towards into. And this is something that AXA and also other insurer players trying to address to bring these integrated ecosystems together. So to answer your questions in short, I think this is something we are all working on at the moment. And just a couple of challenges to do this, especially in China, is that as echoes to comments made by Stanley before, I think the hospitals are still working in silos, especially those government-funded hospitals. So in order for the insurer to integrate the services with the service providers, and there will still need to a lot of collaborations with public hospitals and with patients and with other service providers. And also it needs to have the data available for the insurers to start with, to be able to develop the innovation solutions that can be tailored to the customers. So this is a challenge the private insurers are facing at the moment.
Thank you. I've got some questions on my screen here that are very relevant to the current discussion that we're having, and I'm going to read them because they do relate to exactly the subject we're dealing with. One of them is from Zun Xu, says, what is the biggest challenge in telemedicine industry in your practice? And then another question really for Stanley, how does DXY make sure your knowledge bank is reliable? What if a patient uses the information and makes a wrong diagnosis? Who would be held responsible? And another question for you, Stanley, do you have plans for international expansion, and what will the challenges be for doing that? So maybe we'll let Stanley come in and mention what he's doing in some of those areas.
Sure. Thank you for these questions. So what is the biggest challenge? From my perspective, I think the biggest challenge is trust. Well, in China, most of the hospitals are state-owned hospital. We inherit the existing medical service system from Soviet Russia. That is public hospital focused. That is state-owned hospital focused. They are very traditional, but they do have a very reputable brand with famous professors, with expensive instruments, and also with very strong reputation on the society. So the publics, the residents, they will go to the public sector to seek for advices or suggestions without any doubts. They have so strong brand and people have deep trust in their brand. But as a private sector, as a startup company, as internet company, well, people will concern, should I trust you or not? That is the issue about brand, about trust. So we take years to build up a trust in the physician first. We spend 20 years in the physician community and build up our brand. So we earned physicians' trust first. Then 5 years ago, we expand our services to the consumer side, to the public. And we repeatedly to build our brand in the public through writing articles, through providing services, through some social events. But the philosophy behind it is the same. Trust is everything, especially in healthcare industry. There is nothing more important than building up trust. And also you should be very cautious about protecting your brand, your trust, because once it damaged or destroyed, all of your efforts will be wasted. So that is my first answer. So the second one is, do we have plan for international expansion? The short answer is no, because healthcare is about culture. We have very different culture. And in China, healthcare, when we talk about healthcare, when we talk about wellness, it related to our lifestyle. But the lifestyle in China would be very different with UK. So it would be very difficult for companies like DXY to expand our services to other countries. Even in Asia, it could be very different. It's not just about language. Language technology, I think, is not the biggest issue. The biggest issue is the culture behind it. Let me give you an example. We write articles about healthy food suggestions, but the senior people in Beijing, they will care about if they can take some specific pickles, which does not exist in Malaysia. So it is very geographic focused. It's very culture focused. So we don't have plan to extend our service to other countries. And also another question I think is about, I'm sorry, I lost some. How can we make sure our knowledge bank is reliable? This is a good question. First, we have a peer review strategy. Every articles we published will be peer reviewed by 2 to 3 professors in the same field. Secondly, we encourage science-based knowledge. We collect information from reputable journals, from mainstream institutions to make sure the resource is reliable. Then our explanation or our suggestion is also reliable. We have the team working days after days, nights after nights to review each article, to give their feedback about the change, to make sure the quality, because like I mentioned before, quality is very important because it's relevant to the trust. So what if people take some information but makes wrong diagnosis? So first, we are not allowed to do online diagnosis for the initial visit. And we don't encourage people, a doctor, to make online diagnosis. I'm a doctor. I was a doctor. I was a neurologist. My major was neuromuscular dystrophy. So I cannot tell a patient from just an online video conference. I cannot do that. Mostly DXY service is about education and prevention. So we deliver messages and information to educate people, to tell them which way is correct, which way is not, and what knowledge is correct, what knowledge is misinformation. So that is basically what we were doing. But in terms of online consultation, we educate our doctor to give some suggestions to relieve the anxieties, because based on our observation, over 60% online questions were about anxiety, about concerns. So that would be not very difficult to solve. But if the patient is really a real patient, our doctors will suggest the patient to go offline to seek for help, but they cannot receive the online diagnosis or online treatment. We understand healthcare medicine is heavy regulated. That is why we position ourselves mostly on the wellness, on that lifestyle, not on the diagnosis and treatment. That would be very risky and pretty difficult.
Yeah. One supplementary question, Stanley, while you're there. There's one from Matthew Yang. It's about COVID data accuracy and data integrity in your reporting. Very short. We can only have time for a short answer, but I think that's a very challenging question for you.
Very challenging. Yes, it's very difficult. People will believe collecting data is not difficult, but it's wrong, because when the outbreak happened in China, government released they published the data in all kinds of formats, in the Word format, in the PPT, in the PDF, even in the image file. So we use the human labor to collect the data and double check the data. And so in our team, there are 3 roles. The first role is to collecting data. The second role will be double check the data, cross check the data. The third role will be the operating. So these 3 roles play a very important role in our team, but it's really difficult. Sometimes we do make some mistakes, and we also have volunteers team outside, composed by the doctors, CDC guys, and also some professors, so they can pick up some mistakes we made and we change very quickly.
Okay, let's go back to Xing and also to Nick now. Stanley mentioned an enormously important word, trust, which I think you might like to say something about in terms of what you're each trying to do in your own field. And there's another question that we might start to think about too. Healthcare should move towards prevention, which we're talking about. And what do the panel have to say on the position of the pharmaceutical industry in this? So maybe first of all, Xing, and then Nick, you can give us some thoughts on those 2 issues.
Okay, just thanks, Alan. From my observation, I have seen the pharmaceuticals have also started their innovation initiatives within their own company. From a lot of pharmas we have spoken to, they started to leverage the technologies to advance the R&D phase for the drug discovery. This is one trend I have observed. Another trend I have observed is that they are using various technology, many AI, to make the precision of medicines. That means they will use the AI to do the diagnosis, and then in order to increase the accuracies of that diagnosis. So this is the second trend I have seen that's happening in the pharmacies industry.
Thank you. There has been another question about AI, but I think you're beginning to answer it. The answer to the question is, can it be used? Is yes, without any doubt, because you're going to be using it in AXA. Stanley is using, I'm sure, AI and machine data. But let's hear from Nick on those issues, including the one about the pharmaceutical industry.
Yes, I think, first of all, I'd just like to say, I think, obviously, once, certainly if you're in a position of backing others and looking for potential success stories, trust is immensely important, and healthcare is all about trust. So I completely agree with that statement. I'm not sure if I'm entirely in agreement that culture is necessarily it's a challenge, but I don't think it's necessarily absolute. And with right structuring, fundamentally human beings are human beings and needs are very much there. I think technology has helped us to really understand how to mitigate some of those challenges. And of course, you need to be very sensitive when it comes to cultural differences, and those things are very potent, especially on a wellness end of the scale, as opposed to necessarily sort of health care side of the scale, as we already described. But personally, I'm very interested in what will come after this. There are lots of trends, and we tend to talk about trends a lot. I've heard lots of comments about the sector itself, as well as beyond the sector, in terms of what's trending right now and whether those are sustainable trends or it's something that we will see disappear. I think it's very difficult quite often to separate As I said, what is being favored at the moment, is telehealth being talked about a lot for obvious reasons. After all, we are conducting this conference over Zoom, and that's probably indication of how, in terms of kind of a demand, and we all know sort of growth in that space. I'm not sure, again, if that's necessarily always an indicator of what will come after the crisis has bottomed out, if you like. Undoubtedly, it will accelerate various aspects of what we are seeing in healthcare, whether it's the digital, whether it's, again, mentioned teleconsultations. We will see an opportunity to accelerate some of the AI and machine learning approaches, although, again, in a very narrow segment with specific applications as opposed to general applications of AI. I think we still have a long way to go there. And I think some of those techniques or technologies are successfully being deployed in sectors such as subsegments such as pharmaceuticals. And we are seeing that in terms of drug repurposing right now as we're trying to solve the challenge of this particular crisis. And we will see that when it comes to other developments within the industry as well as beyond. So personally, I'm very focused on that in terms of what will come after the crisis and which one of these trends are sustainable and are actually on solid grounds considering the new paradigm.
Yeah, thank you very much. And Nick, we were also thinking ahead to how will and what will the means of investment in all of this new and innovative technology that we're talking about be, and others might have a comment on that, because I spent a large part of the second half of my life helping with the commercialization of research and the startup of new companies. And there are many, many companies now, very small companies, very new companies, highly innovative, much more flexible than large companies with amazing innovative ideas in healthcare. And it's not easy for them to get attention. It's even more difficult for them to get money. So I think the emergence of technology is one thing. The adoption of it and how that is dealt with actually builds the bridge for us, doesn't it, between technology, innovation, health, and investment.
Well, that's right. But if I may say, I think right now what we are seeing is as much as large number of sectors are struggling, and we've seen that in retail, we've seen that in a whole range of sectors, of course, on a global scale. We've seen real activity in health and life sciences, and some companies, actually quite early stage companies, are getting too much attention, and probably for wrong reasons as well. Now, it's not a general statement. Of course, there are some very, very good companies there as well, but it is very important to see through that, and it's very important to understand fundamentals, the drivers of that potential competitive advantage, sustainable competitive advantage that will sustain them throughout this process of the crisis and hopefully beyond as well. So that's a real challenge.
Sorry, we're entering the last 5 minutes of our time. So there was a question earlier that I didn't get to ask. It's a rather big question, and we can only, I suppose, have our estimate and view on it. How long should we expect COVID-19 to be with us? That's a profound question. But if we could all give a quick answer to that. Xing, you can start.
Okay, I have heard of various views from various people. I'm not a health expert, so I'll probably leave this question to other health experts that are in this industry, if that's okay.
Okay, Stanley, do you have a view?
Actually, COVID-19 virus is a single-strand RNA virus. It's more easily get mutation. So I think we would take another 1 or 2 years, even after the vaccine appeared. For the best expectation, there would be no bad mutation. So 1 or 2 years after the vaccine appeared, it would end. But if there is some mutation happen, especially to the bad side, it would be difficult to say.
I have also a quick question for each panelist. As one who have spent my life trying to connect people in different nations for the common good, do you feel that this dreadful pandemic is likely to improve the connectivity and the connectedness, which will lead us to better collaboration worldwide at the right levels? Nick?
I hope so. Certainly that's my hope. And also I hope it will make us to pause and rethink and readdress some of the challenges we're facing globally as we have a multitude of challenges that we face as a human human race. It's very important to think about some of the positives and silver linings in all this. There aren't many, but there will be some that we can build on, such as climate, such as impacts that this is having in terms of how much we consume and how thoughtful we are about each other. And to me, that gives us hope. In terms of challenges, there are plenty of challenges ahead. I'm not in a business of predicting future. I think that's very difficult to do, especially given the level of uncertainty right now. But I think these are multifaceted challenges and questions. And I'm optimistic.
Thank you. And Xing, you think?
Yeah, I think I'm always optimistic about the things. As I said, I think in Chinese, the crisis means has two faces, right? 机遇, 机 means crisis, 遇 means opportunities. So I think as a Chinese, I always say if there is a crisis, there's always an opportunity for us. This is how I see this whole thing is happening at the moment.
That's good. And you have the advantage, Xing, of being part of an international company. So the international connectivity is there in a way as your base. And Stanley, I understand your reluctance concerning international development of DXY. But let me say that I've learned a lot from you in the discussions we've had today and before today. And I believe that some of the things you're doing will definitely enable us to do better things here. So you may not come and do them, but somebody will. But what about the international collaboration generally?
Yes, I agree with you. Actually, we are connecting now. So I do see the opportunity as connection, but the connection doesn't mean we have to do the same thing in other countries. So my perspective is we learned something from the COVID-19 pandemic and summarize lessons and experiences and share with each other. So just like one audience just asked me, he believed that online triage is not a technology-driven thing, but I don't think so, because behind the knowledge bank, behind all the content, the information generation, there is technology such as user behavior analysis, social listening. So all these technology doesn't have to be on the front end. It could be on your back end, but serve your products, your services, makes your content and services more precisely to serve the targeted patients.
Thank you, Stanley. Well, our time is up, I'm afraid. We have had, I think, a very invigorating and full discussion. We haven't answered all your questions. We will have them, and maybe we can answer them beyond today. I do hope also that we will find a way to persuade governments around the world to take a particular pathway forward to enable collaboration at the right level. We at the grassroots must help those companies that are developing all these new ideas in order that they can bring them forward and fund them. And what we invite you to do, and we'll follow this up with a little note to you all, we're going to write and say, would you like to participate in a bit more information gathering after this discussion and this panel? And if you would, then we'll tell you how we would like you to do it and work with us to see if we can bring something a little more enduring from this wonderful discussion. And nothing more for me to do but to thank our fantastic panel for all your comments and your answers, and for the delegates for being with us, and hope that the rest of the event is very, very fulfilling for you all. And thanks again to the organizers. Thank you very much.